Hi everyone, this is Team 2, and today we'll be looking at how Alexa can support patient engagement outside of the clinic. I'll start by giving us a problem overview, stating our goals, and then my teammates will discuss segmentation, solution design, and measuring success. In the Alexa case, the core problem is that patients struggle to manage health between clinic visits. Daily behaviors like taking medications, monitoring symptoms, and attending appointments can be overwhelming. This is primarily evident in older adults with multiple chronic conditions. They manage several medications and several providers at once, so small lapses can lead to severe complications. This is why this population represents a high need and high opportunity for better patient engagement. So, looking at our goals and barriers, our critical goal is to focus on improving outcomes for both patients and health systems. These include improved medication adherence across multiple prescriptions, support appointment scheduling, improve consistent home health monitoring, and reduce preventable complications. To achieve these critical goals, we need to change daily behaviors, and some of these are taking prescribed medications appropriately and timely, logging home health metrics, responding to daily health check-ins, and communicating symptoms and concerns to caregivers. These behaviors don't just fail because patients don't care enough, but they often fail because there are real barriers that affect care. To incorporate the different dimensions of these barriers, we have grouped our categories into three. The first one is cognitive. So, cognitively, older adults struggle with managing multiple medications, remembering the time and how to take their medications and different appointments. And they're also overwhelmed by daily health tasks. Digitally, considering the age of the patients, they have hesitation or anxiety using digital tools, low familiarity with technology, and difficulty using complicated apps and online patient portals. And finally, systemically, care is so fragmented across clinics and support can be really costly to have home care or caregivers.
Now for segmentation. Before segmenting our consumers, I'll introduce four psychographic dimensions that will explain the consumer segments that follow. The advantage of this dimensional approach is that it recognizes that consumers are multifaceted, and these psychographic qualities are dynamic over time and context. Our four psychographic dimensions are consumers who feel empowered on the one end versus overwhelmed about their health on the other, those who prefer paternalism versus autonomy, those who prefer digital versus analog approaches, and those who are trusting versus skeptical of healthcare. I'll now give three psychographic segment examples based on those dimensions. The first segment is the survivalist. Survivalists are overwhelmed and independent. They distrust healthcare and dislike technology. The survivalist combines what Smith and the authors of Health Catalyst call willful endurers and priority jugglers. Survivalists need succinct and clear communication, limited interaction. They delight when you take time to listen to them and give them a sense of efficacy. And they secretly want you to acknowledge that they really do care about their health and to show them how to use that technology. To persuade the survivalists, we recognize that they're mostly low involvement and rely heavily on heuristics. So our AVS solution uses a peripheral approach, emphasizing affect in the big picture, telling stories to counter the case versus a base rate bias, and offering structured choices that preserve autonomy while nudging them in the right direction. Our AVS solution also recognizes that survivalists are especially attuned to attempts at manipulation or coercion and adjusts the strategy accordingly. The next segment are the bureaucrats. Bureaucrats are empowered rule followers who trust healthcare and are technology curious. Bureaucrats combine what Smith and the authors of Health Catalyst call self-achievers and trustful responders. Bureaucrats need clear guidance and instructions and help getting started. They're delighted when you plan and set everything up for them, and they secretly want praise for their dedication and perseverance. To persuade bureaucrats, we recognize that while they may start as high involvement consumers, they often become low involvement over time. So our AVS introduces health coaching through a central approach, with experts giving detailed explanation and instructions, but then shifts to a peripheral approach to maintain engagement, emphasizing persuasion through authority, consistency, and social validation. The third segment are the biohackers. Biohackers are empowered, independent healthcare skeptics who love technology. The biohacker combines what Smith and colleagues and the Health Catalyst authors call self-achievers and balance seekers. Biohackers need a highly personalized and adaptive approach that gives them access to all their health data. They're delighted when you understand their niche theories about health, and they secretly want praise for their intelligence and maverick style. To persuade the biohacker, we recognize that they're mostly high involvement, and so our AVS solution uses a central approach, emphasizing detailed quantitative arguments and endorsements from those they perceive as experts who are still using an evidence-based approach. When biohackers are low involvement, our AVS solution switches to a peripheral approach using persuasion through personnel signals, liking, and common ground and halo effects.
With that, we are excited to introduce our AVS solution. The Alexa Companion is a dynamic home health assistant using EHR data and patient preferences to lower the burden of care complexity for older adults with multimorbidity. The Alexa Companion will provide targeted support with mental health check-ins, a goal and achievement tracker, caregiver alerts if applicable, and appointment summaries. It will also organize and schedule reminders for medications, appointments, and logging home health vitals. Unlike standard reminder tools, the Alexa Companion uses smart analytics to adapt its tone, wording, and information level based on each patient's autonomy preference, level of comfort with technology, and preferred level of engagement, supporting complex care at home for every patient. Once the patient plugs in their Alexa device, they will be prompted with an initial assessment. The questions asked will fall into these 5 categories on the left and will determine which subsegment the patient belongs to. Once the subsegment is determined and the patient follows instructions to connect their MyChart account, the Alexa Companion will tailor voice prompt content as Noah outlined in the subsegment overview. The following data will be collected on the right as the patient engages with the Alexa device and will determine over time if another subsegment would better suit their needs. Here are some communication and content examples for 2 of the 3 reminder categories we talked about earlier. The bureaucrat, who is more accepting of guidance, would receive a more instructive and straightforward vitals collection reminder, whereas the biohacker, who is less accepting of guidance, would receive a non-directive assistance-based prompt. The survivalist, who is overwhelmed with care complexity and also distrusts healthcare and technology, would receive a more succinct appointment summary and more encouragement, like in their vitals check-in. Whereas the bureaucrat, who is eager to take charge of their health and learn more, would receive more appointment summary information and would require less motivational wording for their vitals reminder.
Next, we'll be talking about measuring success. There will be several points of data and research needed for this step, including surveys, health data, and psychographic profiling. Surveys might assess daily routines, comfort with technology, attitudes towards health management, and triggers for non-adherence. Health data might assess daily prescription numbers, appointment attendance, and internet access as well. Psychographic profiling would connect to our dimensions mentioned earlier to understand values and preferences, as well as including tests for cognitive ability, technology literacy, and healthcare attitudes. Measuring success might fall under 3 categories, with engagement metrics, behavioral and health outcomes, and satisfaction and usability. Engagement metrics would look at factors such as prompt response rate, completion, and engagement by tasks. Behavioral and health outcomes would importantly measure health outcomes as well as behavioral aspects such as appointment adherence and self-monitoring frequency. Satisfaction and usability would likely involve feedback surveys so that we can continue to improve the system. Looking ahead, we're looking to optimize system learning over time for continuous improvement, expand the AVS system into other Amazon devices, as well as explore digital connectivity with wearable health technology. To conclude, connecting back to our goals, we hope to better serve patient segments, improve patient health, empower self-management, lower patient financial burden, and alleviate healthcare system demand. Thank you, and here are references.